rectum is the final segment of the large intestine, measuring about 12 to 15 centimeters in adults. It begins at the level of the third sacral vertebra, S3, as a continuation of the sigmoid colon and ends at the anal canal. Its primary role is to store feces before defecation. Here's an overview of its anatomy. 1. Structure, shape, and position. The rectum follows the curve of the sacrum and coccyx, forming the sacral flexure. Near its termination, it forms the anorectal angle at the puborectalis muscle. Parts: upper third, covered anteriorly and laterally by peritoneum. Middle third, covered anteriorly by peritoneum. Lower third, no peritoneal covering, extraperitoneal. 2. Wall layers. Mucosa contains simple columnar epithelium, numerous goblet cells, and is rich in lymphoid tissue. Submucosa contains blood vessels, nerves, and lymphatics. Muscularis propria. Inner circular muscle layer. Outer longitudinal muscle layer. Adventitia or serosa, the outermost layer, depending on the location, serosa in the upper rectum, adventitia in the lower rectum. 3. Arterial supply. Superior rectal artery from the inferior mesenteric artery. Middle rectal artery from the internal iliac artery. Inferior rectal artery from the internal pudendal artery. 4. Venous superior rectal vein drains into the portal vein. Middle and inferior rectal veins drain into the systemic circulation. This dual venous drainage is significant for the formation of rectal varices in portal hypertension. 5. Lymphatic drainage. Upper rectum drains to the inferior mesenteric nodes. Lower rectum drains to the internal iliac and sacral nodes. 6. Nerve supply. Sympathetic via the lumbar splanchnic and hypogastric nerves. Parasympathetic via the pelvic splanchnic nerves, S2, S4. Somatic innervation for the external anal sphincter via the pudendal nerve. 7. Anorectal junction marks the transition from the rectum to the anal canal. Histological change from columnar epithelium to stratified squamous epithelium occurs here. 8. Clinical relevance. Hemorrhoids, distension of rectal venous plexuses, rectal cancer. Common in the rectum, lymphatic spread depends on the tumor's location. Fistulae can involve the rectum due to infections or inflammatory conditions like Crohn's disease. This detailed structure-function relationship is crucial for understanding rectal disorders and their management.